What do you know about prostate cancer? Could you be at risk? These are questions that every man should ask himself, especially those over the age of 40. You see, prostate cancer is not just another type of cancer. It's the second leading cancer among men, and it's on the rise. In fact, it accounted for about 29% of cancer cases diagnosed among men in 2023 and 11% of cancer deaths. Now let's talk about the prostate gland. Located between the bladder and rectum, this small organ plays a critical role in the male reproductive system. It's responsible for producing fluid in semen and assists with its ejection. But like any other part of the body, it's susceptible to cancer. Prostate cancer is a serious issue that affects many men, but just how can we detect it? Stay tuned to find out. There are two main methods to screen for prostate cancer, but both can be uncomfortable. This statement rings true for many men, but let's delve a little deeper into the process. The first method involves a rectal exam where a doctor physically assesses the prostate gland for any abnormalities. This can feel awkward and yes, a bit uncomfortable, but it's a crucial step in the early detection of prostate cancer. The second screening method is a blood test, known as the prostate-specific antigen or PSA test. While a needle prick might not be the most pleasant experience, the information obtained from this test is invaluable. It measures the level of PSA, a substance produced by the prostate gland, in the blood. Elevated levels could potentially indicate the presence of prostate cancer. However, the journey to diagnosis is not always smooth sailing. There are barriers that sometimes prevent men from getting screened. One significant hurdle is the discomfort associated with these tests. The thought of a rectal exam or a needle prick can be off-putting for some men. Another obstacle is the lack of health literacy. Many men might not understand the importance of these screenings, or when they should start getting them. This lack of understanding can be a barrier to regular checkups and early detection of prostate cancer. Susan Mello, an associate professor of communication studies at Northeastern University, who specializes in health communications, emphasizes that people not understanding what they should be screening for, or if they should be getting tested, if they're not going for a regular annual physical, they're not getting those traditional reminders. It's also worth noting that many men are unaware of the risk factors for prostate cancer and how these factors might influence when they should start getting screened. Despite these barriers, understanding the risk factors for prostate cancer is crucial. Knowledge is the first line of defense against this disease. So while the journey might be uncomfortable, it's a necessary one. Awareness, regular checkups, and early detection can make all the difference. So, gentlemen, let's roll up our sleeves, face the discomfort head-on, and take the necessary steps towards a healthier future. Knowing your personal risk factors for prostate cancer can be life-saving. As we delve deeper into the world of prostate cancer, we must discuss some of the main risk factors. These include age, family history, and race, each playing a unique role in the likelihood of developing this disease. Starting with age, it's rare to see prostate cancer cases in men under 40. As men age, the risk of developing prostate cancer increases significantly. This is why it's crucial for men, especially those over the age of 50, to regularly get screened. Family history is another significant risk factor. If a close male relative, such as your father or brother, has been diagnosed with prostate cancer, particularly before the age of 65, your chances of developing the disease increase. The risk is even higher if more than one first-degree relative has been diagnosed at an early age. Lastly, race plays a considerable part in prostate cancer risk. Studies show that Black men are at a higher risk of developing this type of cancer. To put it into perspective, 1 in 6 Black men will be diagnosed with prostate cancer in his lifetime, compared to men of other races who are diagnosed at a rate of 1 in 8. Understanding these personal risk factors is not just about numbers, it's about proactive health management. The American Cancer Society recommends that men at an average risk for prostate cancer begin being screened at 50, while Black men and men with a family history should start their screenings at 45. If there is a history of early age diagnosis in more than one first-degree relative, screenings should start as early as 40. Remember, knowledge is power. If you are aware of these risk factors and understand them, you can take the necessary steps towards early screening and prevention. Prostate cancer has a strong 5-year survival rate, especially when diagnosed early. With a strong understanding of the risk factors, we can move to the next step: treatment options. So, stay tuned as we shed light on the various ways to treat prostate cancer in our next segment. The usual approach to treating cancer is to remove it from the body, but what does this mean for prostate cancer? When it comes to prostate cancer, treatment plans are not one size fits all. They are personalized, taking into consideration factors like the patient's age, overall health, the stage of the cancer, and personal preferences. The first line of treatment is often surgery. This involves a procedure known as a prostatectomy, where the entire prostate gland and some of the surrounding tissue are removed. This procedure is highly effective, especially when the cancer is localized and hasn't spread to other parts of the body. Next up, we have radiation therapy. This treatment uses high-energy rays to kill cancer cells. It's often used if the cancer has spread beyond the prostate gland, or to help control symptoms in later stages of the disease. There are two main types of radiation therapy: external beam radiation, where radiation is delivered from outside the body, and brachytherapy, where radioactive seeds are placed directly into the prostate. Another treatment method is hormonal therapy. Prostate cancer cells need testosterone to grow. Hormonal therapy works by reducing the body's testosterone levels or stopping the hormone from working altogether. It's used when the cancer has spread beyond the prostate or if it returns after initial treatment. Lastly, there's chemotherapy. This treatment uses drugs to kill rapidly growing cells, including cancer cells. It's often used when the cancer has spread outside the prostate gland and hormonal therapy isn't working. These treatment methods contribute to a high survival rate for prostate cancer. In fact, the overall 5-year survival rate is quite strong. If the cancer hasn't spread to other parts of the body, the chance of recovery is about 99%. However, it's crucial to remember that early detection plays a significant role in the effectiveness of these treatments. Regular screenings and understanding your personal risk factors are key to catching this disease in its early stages when it's most treatable. Prostate cancer is treatable, but early detection is key. So don't delay. Schedule that screening today. It could make all the difference. Early detection of prostate cancer can be a double-edged sword, a phrase that rings true in the realm of prostate cancer diagnosis. On one side, early detection allows us to catch the disease when it's still in its infancy, drastically increasing the chances of successful treatment and recovery. In fact, if the cancer hasn't spread beyond the prostate, the 5-year survival rate is nearly 99%. A testament to the power of early intervention. Yet on the flip side, early detection can present a unique set of challenges. A diagnosis of cancer, even when caught early, can be overwhelming, causing fear and anxiety. It creates a sense of urgency, a pressure to act quickly, to make decisions about treatment that can have long-term effects on quality of life. Here's where the science gets a bit tricky. Prostate cancer often grows slowly and may not cause any problems for years, even decades. In some cases, the best course of action might be to monitor the cancer closely, a strategy known as watchful waiting or active surveillance. But in others, immediate treatment might be necessary. This could involve surgery, radiation, or hormonal therapy, each with its own set of potential side effects and complications. As Asier Golazar, Director of Clinical Research at Northeastern's Observational Health Data Sciences and Informatics Center, puts it, there's questions about how to treat them. And these questions are not always easy to answer. The right treatment can depend on a multitude of factors, including the patient's age, overall health, and the stage and aggressiveness of the cancer. This is why it's crucial to have open, informed discussions with your healthcare provider. Understanding the benefits and risks of each treatment option and weighing them against your personal values and lifestyle can help guide you towards the best decision for you. So yes, early detection of prostate cancer can indeed be a double-edged sword, but with the right information and support, it's a sword that can be wielded wisely. With early detection comes the need for informed treatment decisions. Prostate cancer is a battle that many men face, but with knowledge and action we can fight back. As we've discussed, this common cancer has seen a rise in diagnoses, making it more critical than ever to arm ourselves with understanding. By knowing our personal risk factors, like family history, race, and age, we can make informed decisions about when to begin screening. Screenings, whether through a rectal exam or a prostate-specific antigen test, can be uncomfortable, but they are essential in early detection, and detection is our strongest ally against this disease. With early diagnosis, treatment options like surgery, radiation, or hormonal therapy can be employed to combat the cancer. Remember, A prostate cancer diagnosis doesn't signify an end but rather a call to action. If you're a man over 40 or if you know one, encourage them to get screened. It could save a life.